I want to move into some more peripheral, controversial areas of dentistry. First one being amalgams. So let's say somebody at this point already has amalgams in their mouth and they're wondering best course of action. Is it worth taking them out at this point now that they're already in? Let's start off talking about amalgams in general, and then we'll move into different cases that people might be in where they're either thinking about getting them or they already have them in their mouth and safe removal.
Yeah, many aspects that need to be discussed here. Let's start with a child, no cavities. Do not let the dentist put in a metal filling. And we use the word metal, we use the word amalgam, silver fillings. They're all the same. They're half mercury and half silver, and they add other alloys in there. Again, fabulous material for dentistry. It's been around for almost a century. It was very dangerous for dentists. In the old days, we used to make it ourselves, and then we would be poisoned, neurologically poisoned. A lot of the staff, it was typically the staff that got poisoned. There are vapors released from it. Now it comes in a capsule form. It's auto mixed. It's never really exposed. The free mercury is never in volatile form exposed in the operatory until it's mixed. Theoretically, when it's mixed, it's combined with the silver, and you open the capsule and you place it. The reason dentistry loves silver fillings is because it's so easy to use. You got a hole in a tooth, in a wet mouth. You blow a little air on the tooth, and you just condense this material in there with a little plugger, and you can shape it. It hardens. It's strong. Over time, as it oxidizes and starts breaking down, where the edge of the filling meets the edge of the tooth, that's where the bacteria start coming in and creating another cavity. We call that recurrent decay. The oxidation byproducts of the filling actually keep those bacteria at bay. So even though the filling is failing over time, it's still keeping itself and keeping that joint or that union of two different materials, one biological and one artificial. It's keeping it clean. So unfortunately, it has a neurotoxin in it. So again, if you have children, stick with resin fillings. Resin fillings do have BPA in it. There's actually two available. I'm not aware of the other one, but there's one that it's from Germany that I do recommend, and it is BPA free and BisGMA free and free of many things that you don't want your children exposed to. So I can give you the link for that. Just have your dentist buy that. It can be used as a sealant as well. But don't go down that road. Metal fillings are a little cheaper. I would say half the dentists in the US, probably Canada as well, are still using metal fillings. So it's quite prevalent. And that's not to be confused with aluminum crowns. Those are aluminum. That's a different story. Not necessarily a neurotoxin. So first case is don't go down that road. Now, like you and me, maybe I'm misspeaking for you, but most people have metal fillings in their mouth. And I had mine taken out. It took some time. I did it very carefully. I replaced most of them with gold. We can talk about that later. But you can have them replaced with composite. I waited until I found someone that could do it correctly, because the time that the patient is mostly exposed, and the provider and the operator, the clinician and the auxiliary, the time that the biggest exposure is placing the metal filling and removing it. So it really has to be done properly. I'll give you the link for this. IAOMT, somewhere in the Midwest, they have the best protocol for removing. It's called the SMART method, SMART, and you can go to their website, find someone that has that training, and have it done that way. Now, having said that, is that something you want to jump on right away? No. So again, it's like remodeling a house. You want to have a master plan. So you have to know, first of all, if your fillings are doing well, maybe leave them in there for now. You can also have your exposure to mercury measured. The best test is out of Denver. It's called the Quicksilver test. It's a try test. urine, hair, and blood. And you can measure for the amount of mercury that you have in your system. If it's low, you may not want to mess with it until the filling fails. New fillings are expensive. You can delay that. But back to that remodeling metaphor, you don't want to just keep fixing a countertop or a dry rot in a bathroom. You want to have a master plan, because you may have to redo those fillings if you have bigger issues, or maybe you need a crown, maybe the tooth is not savable. Just make sure. I see this a lot. Knee-jerk response. Patient walks in. I used to get this all the time. I want them all out. And I knew exactly what they meant. It wasn't their teeth, it was the metal fillings. And then I would try and incorporate that into a well thought out plan over time, get it done safely, and take away the panic aspect of it, and get them tested as well. And because you can get into a lot of trouble. So a lot of people are going to their dental offices, they're saying, take them all out. It gets done all in 1 or 2 visits. It's not being done properly, and they just inhaled a lot of mercury. And then now they have more mercury in their system because of that knee-jerk response. So that's if you already have them. There are a lot of other smaller questions, like, can you leave them underneath a crown? Does it leach through the tooth into the pulp? Are there safer versions of amalgam? No. I would, at some point in time, have a plan that is feasible and is done, sequenced correctly. Try and get them taken out, but only before you know how much mercury you have in your system. And if you're high in mercury, that's likely the source of being high in mercury. That would be a good time to act. If you're really low in mercury, then you're kind of, what's that called? When you kind of stir the pot, you're just, you could make things worse. And then obviously test afterwards. Make sure that the process itself didn't expose you to a lot of mercury. So you really have to be in the hands of a very talented dentist, not just clinically, but in terms of how you address the exposure during and after, and how you chelate it, and there are dentists that can do that. So what I think my point is that you have metal fillings, no knee-jerk response. Don't get them all out right away, and make sure you've picked the right person. And not every dentist. There are only a fraction of dentists that do it properly.
Okay, you mentioned this product from Germany that is safe or safer. You talked about the fact that when you had yours removed, you went to gold. I also know there's ceramic. Let's talk about all the different quote-unquote safe options, and then how does somebody pick the best for them?
Right. Zirconia, high-quality gold. We call it high noble gold. There are other lower qualities of gold with a lot of alloys in them that you don't want. We've got metal fillings, of course. We're not going to talk about that as an option. And then there are the composites, the ceramics, the plastic fillings, all the same category. Those are put in with resins. Sometimes we use acetone to help clean the tooth. They are more technique sensitive. They have to be used sometimes with a rubber dam, a lot of isolation. And again, that's the advantage of the alloy. Any poorly trained dentist in the old days, it was just non-trained. They would just take alloy and just stuff it in there because it works and it would last and it's resistant to moisture and all that. But composites have to be put in with a dry field. They have to be layered sometimes. There's beveling. You can't just cut a hole. It's there, and that's why they cost a little bit more. But insurance does cover typically 80% of the procedure. So, but you do want to use a safe product. The product that I've been recommending for a long time is the Admira Fusion out of Germany. There is one other product. I'll try and get you that link as well. But again, that's the minority of products. The majority of products out there are pretty toxic. If you had to pick between a toxic ceramic filling and a metal filling, I would choose the plastic filling. It's a terrible choice to have to make. But then we have, I'll save gold for last because it's really one of the oldest and best materials in the mouth, believe it or not. But it's going to be hard to find someone to place it properly. Zirconia. So first we had porcelain, and that was just glass, and it was stacked, and there was a mechanical locking to a low noble or a base metal, and we've steered clear from that. They don't look very nice, and so now we have a pure ceramic product. It's called zirconia. You can make implants. Implants are made out of zirconia. Good alternative to titanium implants. Pretty inert, pretty strong. Slight risk of fracturing. You need more thickness, which means more reduction of the tooth to provide resistance to that. But zirconia is incredibly strong. In fact, many zirconia crowns will break, and then the other part of the crown is still hanging on and can for years. Where in the old days, when porcelain broke, it would just start crumbling and falling apart, and you'd have to act on it right away. So zirconia is pretty safe. One caveat on zirconia is that if the dentist is doing a lot of grinding on the zirconia crown to get it to fit properly, make sure they're doing that grinding elsewhere near a hood, a ventilated hood, or everyone's wearing masks, or the room is well ventilated. I mean, there are several degrees of efficacy there. Breathing in zirconia is not a good idea. So, and dentists do have a higher incidence of lung irritation and issues if they're not taking precautions because they're around it all day long. The patient is not. They're just there for that 1 or 2 or 3 visits in their lifetime. But again, I'm paranoid about these things, and if there's a way to prevent something, I'm going to point it out, or behave in a way where I can prevent that. So zirconia is a great material. Veneers, crowns, implants. It's a real boon for the industry. It's strong. It's reliable. It looks good. It has great high aesthetic value in the hands of a gifted cosmetic dentist. So not a bad material. Pretty inert. The only caveat there would be the grinding in the operatory to make it fit. And then how well can it be polished afterwards? Typically, if there's a lot of grinding going on, the crown doesn't fit, it's probably time to make a new one. Or if it does get ground and it fits nicely, it looks good, send it back to the lab and get it glazed, get it properly treated. The polishing that dentists do in the office isn't quite the same. This is probably more information than you want, but it is related to safety. And then gold. The gold standard, right? It fell out of favor. It was expensive, difficult to do, very technique sensitive. It is the high end, what I call the Formula One race program, and all those techniques. Even if you're not doing gold, the techniques of prepping a tooth to be conservative, to hide gold visibly from a forward view, build up techniques and saving tooth structure. Gold is a very, very conservative restoration, and it's soft. It wears at the same weight that enamel does. Zirconia does not wear at the same rate that enamel does. So eventually it becomes an island in the mouth. It can become it can sit a little bit high in the patient's bite. Enamel wears at 5, 6, 7 microns a year. That's normal. You want gold. There's a Tucker gold. It's named after a famous gold technician. It wears at exactly that same rate. It's designed to wear at the same rate that other teeth do. Thermally, in terms of expansion and contraction, these are all coefficients that dentists are very concerned about. It is a very friendly material. The one drawback, maybe there are 2 drawbacks, but the one drawback for most patients is cosmetics. My wife has gold inlays. Nobody ever notices them. You can hide them. In certain areas, it's the way to go. You don't have to put in a composite. You can go right from a metal filling to a gold filling, and chances are that gold filling will be the last thing you ever do to that tooth. That's how long gold lasts. Does it cost a little bit more? It's the same cost. It's an indirect method where you have to take an impression, send it to a lab. So it's the same as a crown. You can do gold crowns as well. They last, and they don't leach anything into the body. They're very biocompatible. Finding a dentist to do it is difficult. I can give you a list of dentists. It's still, again, it's the race program. I was in it for over 10 years. Probably the most fun and the most difficult learning experiences I've ever had in dentistry. And again, you bring in your own patients. In the morning, you work on your patient with another dentist, and then you swap. All of your work gets projected up on a high resolution screen, and they pick away at it. It is an amazing restoration, and it is still in use. It's all over the world. The Japan, Germany is big on it, the Netherlands. There are these Tucker study clubs all over the world. They're in Canada. In fact, they're very big on the West Coast in Canada. He's Dick Tucker. It's not with us, unfortunately, anymore. Richard Tucker was an amazing man, but his son is still keeping it going. And then the beauty of that Tucker method is it's not just the dental work and the clinician's work. It is the communication of the clinician and the work of the lab person who's making the gold. It's that relationship that I've never seen so intimate and so functional and ever in any process in dentistry. That is what all the training is about. So that would be the very high end, and you don't hear that being talked about very often, do you? Gold.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
We use the word metal, we use the word amalgam, silver fillings. They're all the same. They're half mercury and half silver, and they add other alloys in there. So a lot of people are going to their dental offices. They're saying, take them all out. It's not being done properly, and they just inhale.